Today, I want to talk to you about a health issue that is particularly relevant to newlywed couples. What is honeymoon cystitis and why does it occur? Let's explore together. Cystitis refers to inflammation of the bladder. It is typically caused by factors such as insufficient water intake, using unhygienic or dirty toilets, transmission through contaminated toilet seats, or frequent sexual activity, which can lead to irritation of the vulva and urethra, resulting in infections. This condition is more commonly seen during pregnancy and the postpartum period. There are several reasons for this: the pressure exerted by the baby on the bladder, a reduction in bladder capacity, insufficient water consumption, and the effects of pregnancy on the urinary system. All of these factors increase the risk of urinary tract infections and cystitis. But today, we are talking about a specific type of cystitis: honeymoon cystitis. Honeymoon cystitis refers to the bladder infection that occurs in newly married couples, specifically in women, during the first month of their sexual life. Why is it less common in men? The reason lies in the urethra. In men, the urethra is longer as it runs along the length of the penis. This means that any infection has to travel a much longer distance to reach the bladder, which makes the journey for bacteria more difficult. In women, however, the distance between the vaginal opening and the urethral opening is only 1 to 2 centimeters. This shorter distance, combined with the initiation of a new sexual life and often frequent and sometimes uninformed sexual activity during the honeymoon phase, creates a higher risk for infection. You are starting a new sexual life, and naturally, you are excited during this process. Young people spend that week a bit unconscious with excitement. You are starting a new sexual life, and naturally, you are excited during this process. Young people spend that week a bit unconscious with excitement. Drink plenty of fluids. Drinking at least 1 pitcher of water with lemon daily can be very helpful. However, don't limit yourself to just plain water. You can also drink mineral water, Aeron, and herbal teas. Take vitamin C. Vitamin C has a protective effect against infections. You can drink lemon water or consume vitamin C-rich foods like rosehip tea or kiwi. Additionally, you can carry vitamin C tablets and dissolve one in water daily for a convenient supplement. After sexual intercourse, try to urinate as soon as possible. This can significantly reduce the risk of infection. Additionally, clean the vulva and avoid leaving semen in the vaginal area for prolonged periods. Your partner's sperm must also be clean. If you marry a man who has a sexually transmitted disease, especially gonorrhea, and engage in sexual intercourse, conditions like Bartholin's abscess, urinary tract infections, and vaginitis will be much more severe and frequent. The vaginal pH is naturally acidic, whereas semen is alkaline. Leaving semen in the vaginal area for too long can create an environment conducive to yeast infections, such as candidiasis. This is why we often see yeast infections in newly married women. In summary, we should drink plenty of water and consume a good amount of vitamin C. After sexual intercourse, you should wash the vulva, pay attention to hygiene, and avoid any actions that could irritate the area during this period. For instance, if you experience discomfort or soreness after the first intercourse, you can use the creams recommended by your doctor and take a day off from intercourse to allow the area to rest. This way, you can avoid cystitis during that week and ensure that your adaptation to sexual activity is more comfortable, fulfilling, and of higher quality. Well, we've come to the end of another video. I hope this has been helpful for newlywed couples. I wish you all health, happiness, and a long life together on this beautiful journey. May you have a long and happy marriage. Take care and goodbye.